Welcome, everybody. You're listening to the Maximize Living Radio Show. My name is Dr. Nick Barnes. I'm your host and also the owner of Health from Within Family Chiropractic. We are a local health center here in the St. Louis region, bringing you truth about health and healing over the airways. And today's going to be an incredible show. We have some amazing testimonies and just some awesome things that we're going to just talk about. That's going to discuss what's going on in our culture and what we can do differently to be set aside, set apart, and be counterculture. And so that way we get better results. And so we know right now in our culture, people want to be healthy and well, but they're really just sick and tired of being sick and tired. We have thousands of patients that come into our clinic week in, week out, getting incredible results without drugs or surgery. And that is why I'm on the air. That is why I have a mission to transform healthcare by transforming the way that you view and manage your health in order to prevent and reverse sickness, suffering, symptoms, and disease. And we realize that right now in our culture that we're told that when you're sick, go to the hospital. When you feel bad, take a medication. Maybe you have to get this surgery. Maybe the sickness, symptom, or disease runs in your family. Maybe it's because of your age. And so at the end of the day, there's three things that we got to start to do in our culture. One is we got to start to take responsibility. We have to start to take responsibility for our health, because at the end of the day, most of us were raised and been told that if you feel bad or look bad, it's your family's fault. It's someone in your genes. Someone from something that you've just been born with. And so what I will tell you is that we have to start taking responsibility and not blame our problems on our family members or our genetics. And so right now, what medical research proves and shows is that less than 9% of what happens to us goes back to our genetics. So less than 9% of what happens to your health goes back to your genes, and 91% goes back to what you do to your body and what you don't do to your body. And so to me, that's a good thing. For some of you, you're saying, oh man, that's not very awesome, because now I can't blame my bad right knee on my mom, or I can't blame my weight issues on my dad, or whatever the case may be, right? And so we got to start taking responsibility. And it's not our genes. It's not our parents bad. It's not our grandparents bad. It's what we've done or not done to our body for years at this point. Secondly, when it comes to take responsibilities, we blame our health problems on our age. We say, well, I'm 40 years old now, or I'm 50 years old now, or I'm 60 years old now. I guess this is when I should get on a medication. Why? Because everyone else is doing it, right? That's what we're told. That's what we're taught, right? We think that as we get older that a joint is supposed to hurt. So just this past week, I had someone come to the clinic and say, well, my right shoulder hurts. I think it's just because I'm 60 years old now. I think it's just because of my age. Well, and I asked her, I said, hey, how old's your left shoulder? And she laughed, but it got her thinking that, well, wait, my shoulders are the same age, right? They're both 60 years old. It shouldn't be one going bad or becoming painful because it's a certain age. So we can't blame our health problems on our age or our genetics. And we know age is a factor to health, but how old you are doesn't determine how healthy you are. And I know this to be true because we see some of the sickest people in our clinic are people in their 20s or 30s or teenage years. And some of the healthiest people are people in their 80s and 90s, living an amazing life. And so you can't base your health off of your age or your genes. Now, the second thing we have to do in our culture is understand what is health. Like what is the most important thing to health? And that is, we have to understand what the definition of health is first, right? So we have to understand the definition of health, and we've got to understand how to achieve health. And so the definition of health, it means that your body must be healing and functioning 100%. It's not the lack of sickness, symptoms, or disease. But so many times in our culture, we say, well, if I feel fine, I'm good. But if you talk to the best oncologists, cardiologists, endocrinologists, any ologists, any medical specialists, they'll say that you can actually feel fine, but have disease in the body. This is why there's medical tests such as colonoscopies and mammograms and blood work, and why you go to the dermatologist to get your skin checked, is because you can actually look fine, you can feel fine, and still have cancer. Medical doctors and medical research proves this, right? Why do we go get our blood checked? Why do we get our cholesterol checked? Because you can't feel when your cholesterol is high. Many people can't feel when their blood pressure is high. Right? We can't feel sometimes when our A1C is high, right, for blood sugar. So at the end of the day, we base our health off of how we feel, but medical research proves and shows that we can actually feel fine, look fine, and have disease in the body. And so we can't base our health off of simply how we feel, because sometimes being healthy doesn't feel good. For instance, if you're exposed to a virus or a bacterial infection, What's going to benefit you and your body's going to help you get over it is a fever. And fevers do not always feel great, but fevers are there to benefit you. They're there to help you. Why? Because it literally kills the virus. It literally kills the infection. And so what we do in our culture, we say, well, if I have a fever and I feel bad, I don't want to feel bad. So I'm just going to take this Tylenol to reduce the fever. And therefore I feel better. But in the long run, it's actually going to make me sicker because now it stopped my body doing what it's supposed to do, which is fighting off the infection, right? We do the same thing with allergies. If our nose is running or if we're congested, we take a allergy medication. Many of you take it daily, year round, and you think that's okay. It's not okay because what's happening is your body's telling you something's wrong. It's trying to actually help you. If you've been exposed to allergens in the environment or in your home, your nose is going to start running. And so your body's going to start to drain all the junk out of you. And we say, well, that's uncomfortable. So now I need to stop up the drainage. I need to stop everything up. That doesn't make sense either. So now you feel more comfortable with the medication, but in the long run, maybe 2 to 3 weeks later, you get something called a sinus infection. It's because you kept all the allergens and all the junk in the system instead of your body trying to get rid of it, right? How about if you have food poisoning, right? If you have food poisoning, your body's going to get rid of that one way or the other. If you know what I'm talking about, we're going to go to the top or the bottom. It's going to get rid of get rid of it. But many of us will say, well, I want to take this Imodium D, or I want to take this whatever medication that's going to stop me from using the restroom, stop me from having to throw up, right? And so, listen, the body's going to always work for you on your behalf, regardless if it feels good or not. And so health means your body must be healing and functioning 100%. It's not how you feel, and it's not based off of how you look. Let's talk about that for a second. So if people base their health off of how they look, guys, I know some people that are really thin who are super sick and medicated. So it's not based off of your weight. It's not based off of your BMI. Listen, guys, I'm telling you this, that if you're focused on being healthy from the inside out, if you focus on eating clean, if you focus on movement, your body's going to do everything it needs to do to help you. If you're simply focused on how much you weigh on the scale, that's not the answer. Guys, I've taken care of some of the most elite athletes in the world, the Olympic athletes, and we take care of local athletes here in the St. Louis region. And they look super fit on the outside. They have a six-pack. They're doing everything right. They're eating clean. They're exercising. They're doing a lot of things right. But then why do they have gut issues? Why do they have neck pain? Why do they have numbness and tingling or headaches or anxiety or sleep problems or immune system problems? Why do they have all those things? It was simply based off of how you look, then they would be super fit, they'd be super healthy, and they'd feel amazing, right? Guys, I'm telling you this, that eating clean, exercising, being fit, taking supplements, all of those things are important for your health. All of them contribute to the healing process. But I'm telling you this, there's only one thing that controls all the healing and function in your body. And it's your brain, your spinal cord, and your central nervous system. Right now, for your heart to beat, for your lungs to breathe, for your stomach to digest food, for a cut to heal in your hand, your brain controls it all. That power that's within your brain literally travels down the spinal cord, out of the spine, across these nerve roots that branch off and go to every single cell, tissue, and organ in your body. So for your body to process food, for your heart rate to be able to respond to the workout you're doing, for you to be able to get sleep at night and recover and repair and be renewed on the cellular level, your brain controls it all. And we were given a spine to protect the central nervous system so it can function and heal us at up 100%. And the spine must be in proper position in order for us to heal and function. And so from the back, our spine must be straight up and down, and our hips must be even, our shoulders must be even. Everyone knows this. But most people don't know this fact, that from the side, you must have 3 45-degree curves from the side. You have to have curves from the side. Why? Because that's how God designed our body to be able to heal and function optimally. Or our spine acts as a spring. So if we're sitting, walking, running, standing, whatever it is, our spine compresses and then it expands. That's why we have those curves. We can't be walking around with one hip higher than the other, one shoulder higher than the other, a minor scoliosis or severe scoliosis. That's putting damaging pressure on the nerves. Losing those curves from the side puts damaging pressure on those nerves. And if there's pressure on the nerves, if there's dysfunction in the structure, it causes dysfunction in the body. And when there's dysfunction in the body, that's when sickness, symptoms, disease, and suffering sets in. And guess what? You can eat all the kale in the world. You can have you can work out for 4 hours a day, but there's damage in your spine. There's no way you can fully heal it 100%. Once we understand it to be a truth and a fact and not just a belief, that's when we start to see truth happen and healing happen. So 1 is taking responsibility. 2 is understanding what health is and where it comes from. Our body must be healing, and it is controlled by the central nervous system. And number 3 is taking action. And one of those patients that took action, once he heard the truth, his name's Joe. Joe heard us on the radio show about 3 months ago, and he called in and he goes, Dr. Nick, I'm a stubborn middle-aged man. I'll be honest with you. He goes, I have low back pain on and off for years. And I've been to the best specialists in the St. Louis area. They said, try this injection, try these medications. And if it gets bad enough, we'll have to do surgery. He goes, this doesn't make any sense to me, but what you said on the air makes complete sense, that if the structure is off, the function is off, and that will lead to more medication, more surgeries, and more injections. He goes, I don't want that. So I want to figure out what my structure looks like. And so what we did with Joe is we said, all right, Joe, let's see what your spine looks like. We sat down with Joe. We figured out, okay, he has damage in his lower back from past injuries at work. We did a nervous system scan, which showed us muscle imbalances from side to side that were off the charts. And we did a full set of x-rays. And what we saw with Joe is we saw a disc degeneration in the bottom 3 vertebrae. We saw that he had a minor scoliosis for years, and he had lost the curvature in his neck. It was causing bone spurs to develop and damaging pressure on the nerves. He goes, Dr. Nick, but I don't feel pain in my neck. I go, Joe, you can only about 10% of the time you feel pain in the spine. And so the neck is actually impacting the lower back as well. Everything's a mess, but the good news is if we do something about it, we're going to be able to correct it and fix it so you don't need surgery, so you don't need injections, and you don't need medication. Does that sound good to you? He goes, I have nothing to lose. I go, that's exactly right. Let's get you started with chiropractic care in our clinic. We started adjusting his spine rigorously. We started doing spinal rehab with him. And guys, now it's been 3 months. He's on no pain relievers. He's on no medication. He hasn't had to go back for injections. And guess what? He's walking better. He's playing golf better. He's standing. He's not limited anymore. Before, he couldn't even have a vacation because he was worried about how long he'd have to be sitting. And now he has his life back. Now he's not worried about the next surgery or the next injections. Now he's figuring out what can he do? What can he do to benefit his health and to make sure his spine is healthy? And so there's a lot of people out there wondering, like, if that's me, what do I got to do? Well, normally to come into our clinic for a new patient appointment, normally it's $150 if you're walking off the street. But if you're listening to this show right now and you say, man, what if he can help me? The first step is by scheduling an appointment. And the good news is if you call in right now, instead of it being $150 for the new patient appointment, it's only $60. Literally, you save $90. So if you want an appointment, all you got to do is just pick up the phone and call in. When you call, I will schedule you for a new patient appointment. We'll take the payment over the phone of that $60. And that way you don't pay anything when you come in. Right? This is the catch. You just got to pick up the phone and call now. The number to call right now is 314-323-7214. It's 314-323-7214. We'll be right back after the break, coming back even stronger. Thanks, Facebook, for tuning in. Share this with everybody you love and care about. And if you have any questions, just post it in the comment section. And love you guys. And tune in next time.